welcome back to the Tooth Doctor YouTube channel here at Ellerslie Dental. We're actually at the Ellerslie location for the Tooth Doctor, and today we're actually going to be talking about common dental implant problems. So I'm here with Dr. Peter Yoo from the Tooth Doctor, and my name's Karen, and we're going to break this down today for you guys. So the meaning of life is to find your gift. The purpose of life is to give it away. Just an anonymous quote there. According to numbers from iData Research Inc., around 90,000 dental implant procedures were performed in 2005, with a promising growth rate of 14.2%. It was estimated that the numbers could reach 200,000 within a decade, depending on the market and the needs of dental patients. I think that's because there's more awareness of them maybe now than there was previously.
Very true.
Yeah. So what is a dental implant?
Well, a dental implant is basically a titanium screw. There are other types out there, but I'm going to just focus on the titanium implant. And so it's a screw that replaces what the root would be, and then from there you can attach a crown on top of that and basically replace a tooth.
Okay.
Yeah.
All right, so what are some of the reasons that a person would get a dental implant?
Let's start off with, I guess the most common one is when you have to pull a tooth out, right? Whether it be due to big cavity and the tooth is not fixable, unrestorable. Sometimes you fracture a tooth. Okay, so anything that leads to basically not being able to restore a tooth. And then you get some people where, years in the past they just couldn't afford it or something and just had a tooth pulled out. And so now they have a space there. So, yeah. Other reasons are sometimes you don't have a tooth there. So we call it congenitally missing.
Oh, okay.
So there are certain teeth that are more common on missing. Some people have 4 wisdom teeth. Some people have no wisdom teeth. Right? Those are the lucky ones. But but in regards to sometimes in the teeth that you kind of eat and chew with, there are people that have those types of wisdom teeth.
Okay.
Oh, yeah, and one last thing is sometimes, again, in relation to that, you have some patients where they're missing a tooth and the baby tooth is still there. And so later on, that baby tooth can get loose and it'll come out, and now you have to put something more permanent.
Okay. Are there areas of the jaw that are better for dental implants than others?
I would say yes and no. I guess more so for, if you can understand, I'll use the example of patients that have all their teeth gone. Okay, so now they need implants in their top jaw and they need implants in their bottom jaw. So we understand in the dental field and as dentists that there are certain degrees of density. Okay, so the denser or the thicker, I guess, the bone is, the more it's able to hold an implant.
Right.
Okay, so technically the jawbone on the bottom is actually a lot more dense or stronger than the jawbone up top. Okay. In numbers wise, to make it relatable, a patient that has a lower denture, they want to get implants. Usually we can put in between 2 to 4 implants. Whereas for the top, you need a minimum of 4 to possibly 6 implants. So you do need more implants for the top jaw than the bottom.
Oh, interesting. Yeah. Are there some issues you've seen that hinder the healing process after a dental implant process?
Number 1 is smoking. Yes, the smoking is like the #1 reason, because of the chemicals that don't allow for the healing of the tissue and the bone. And so, when you place an implant for a person, you have to wait a certain period of time because you need that bone to kind of grow into the threads of the implant screw.
Okay.
That is called osseointegration. Okay. Bone is binding to the titanium.
Okay. All right. So, what is the best way for someone to care for their new dental implant?
Basically, like as if you care for your teeth. Okay. The saying goes, your implant will only be as good as your teeth. Okay. Implants don't get cavities. Okay. But you can lose bone around implants like you lose bone around your teeth. So if your teeth aren't healthy, your implant may not be healthy. Okay, so taking care of your teeth, doing the proper things will lead to long-term success of an implant. Okay, getting back to the previous question about what hinders healing. So again, smoking, just not caring for the implant. Like a lot of people are very harsh on their teeth. It's very important to go see a dentist at least every year to make sure that the implant is healthy. There are differences between your teeth and your implant, and I'll get to that in a little bit.
Okay.
But yeah, making sure you're brushing, keeping them clean like you normally would.
Yep. Are bite issues after a dental implant placement common?
Bite issues? Yes. Okay. So actually, yeah, let's talk about implants.
Okay.
So yeah, implants in comparison to teeth, you can't get cavities. Okay, we talked about that already, but you can still lose bone like you would with a natural tooth. Okay. Now the other thing I usually relate, and I kind of use my hands, that makes sense, is that when you bite on your tooth, it can actually go down a little bit.
Okay.
Because when you eat, I use fish or an egg. If you have a little shell in the egg and you're biting into that, you can feel, your teeth can actually feel that shell. Okay. When you have fish, you can sometimes feel the bone when you eat that. So your teeth actually have a tactile sensitivity, a sensitivity where they can feel different textures. Okay, that's what it's a reaction. Like you're eating. I'll use beans for example. You're eating beans and there's a rock in the beans. When you bite into that, your teeth have a sensation, and that actually causes your jaw to open back up quickly, so that you don't hopefully chip your teeth. And unfortunately, some people do. Yeah. So implants don't move, whereas teeth do move. So implants are stuck in the bone. So you have to be aware of how your bite is. And so getting back to that, when patients have implants, it's very important to get your teeth checked once a year to make sure there is there's a very light contact or even a space between your implants, or if you have tooth and implant, there is actually a slight bit of space. They're not actually touching, because again, when you bite down on your teeth, and if you clench a little bit more, your teeth actually will move a little bit.
Right.
Okay, so with an implant, we want that, I guess you call it in the clenching mode, right? You want that implant to be contacting in the clenching mode, so that when you are in just a regular biting mode, there's a very slight space.
Wow.
Okay.
Makes sense. So how do you avoid or fix bite issues for dental implant patients?
One thing that we do on a routine basis is using bite paper. Everybody knows the bite paper, that blue, you bite on it and it causes blue marks or red marks on your colored marks, right? There's also something called shim stock. And so basically it looks like a little foiled ribbon. And so it's thinner than that bite paper. And so we basically get patients to bite on it, and when they bite down, then if we can slide the paper, the ribbon out, then we know that there's space. Okay. Normally when patients bite, if they bite down on their natural teeth and I put the ribbon in, I can't pull it out, it'll tear. Okay, so now I know, oh, there's contact on their teeth. So we actually want very little contact. So coming in and getting that checked every year, because once you start, a little bit of understanding is that your teeth are designed to move upwards and forwards. So when you have a little space, your tooth is thinking, oh, there's a tooth up there somewhere, I'm just going to grow a little bit more and try and come into contact with that. Okay? So year after year, you need to get it checked to see if your teeth have moved slightly. And it's not a big movement. Okay? One way of preventing that also is wearing like a night guard. So patients that have multiple teeth, multiple implants, we usually recommend a night guard, because that will keep the teeth and the implants in their position, and so that will prevent the teeth from coming into contact over time, and not having to adjust the implant. Adjust the crown on it.
Right. Yeah. So what can be done if a dental implant becomes loose?
Come see us at the Tooth Doctor Ellerslie. You know what? I've done a ton of implants. And we have one of the most common things with implants is that the screw that holds the crown does get loose.
Okay.
Yeah, and it's not a big deal, but you do have to come see the dentist. We basically can go in, basically unscrew the crown, make sure everything's clean, make sure there's no damage.
Yeah.
We re-screw the crown back on, we take an x-ray, make sure it's all seated properly, sealed, and then we can have the patient go. Getting to that point, there are two types of implant crowns. Okay, there's ones that you screw on. Usually the crown has a little tiny hole where the screw will go in, and then basically afterwards we put a little white filling to cover that hole up. Okay, and so I like using those because we call it retrievability. Okay, again, if the implant gets loose, I can just drill out that filling, get to the screw, unscrew it, take off the crown, make sure everything's clean, put it back on, screw it back on, cover the hole, and you're done. Okay, and then there's a cement retained crown. Now, a lot of dentists in the past feel that that's better because it looks better to a degree, and sometimes it's you have like a front tooth, depending on the angulation of the implant screw. Sometimes you can't have a screw retained crown, and so sometimes they actually, once they place the implant, they actually cement on the crown, and now you're a little bit stuck.
Yeah.
Okay.
Okay. So are bone grafts common for dental implant patients?
Bone grafts are meant to help support the implant. We will obviously, if you have a big tooth, you want a bigger implant. If you have a small tooth, you want a small implant. You don't ever want a small implant for a big tooth because of just the shape of what it would look like. So imagine a mushroom. Okay?
Yeah.
Mushroom. You have a tiny little stem, and then you have a big head there.
Yeah.
So you don't want your implants to look like that because then food can get underneath and it traps, and so it's hard to clean and maintain, and so food gets underneath, that damages the bone, and what's holding the bone? Or what's holding the implant? The bone is.
Yeah.
Right? So ideally you want it as big as the implant and have the crown contoured nicely so it's easier to clean. So bone grafting is meant when there's, people have lost tooth for many, many years. For us, let's say a patient has to get a tooth pulled out. We will pull the tooth. We tell the patients in the next 3 to 6 months, the bone will fill into that hole and the bone will stay. But after 6 months, that bone will start to shrink and shrink and shrink and shrink. Okay? So if you have bone like this and you have an implant like this, okay, if the bone is only like 2-3 millimeters, and you need an implant that's 5 millimeters, well, you're not going to have bone covering that implant, right? So you need to have a certain thickness and width and depth of bone in order to place the implant. So bone grafting is very important when we need to create space and just, we want that ideal implant size, so we don't compromise and get the best long-term success and prognosis.
Nice. So what's the average healing time for a dental implant after you've had it?
The average is anywhere from 12 to 16 weeks. Okay. Everybody plus or minus, just depending on the person. So, my simple rule is, once I place an implant, I'm going to wait about 3 months. Okay. And hopefully by that time, everything has healed. And and then we can place a tooth on there and put some, we call it load. So we can put pressure on the implant, and the implant will be stable around the bone.
Okay. It's a whole big procedure, but
it is. Yeah. It is, and it's everything just depends on how the patient is, care, just like everything else. There are implants called immediate implants. Okay, so they actually place an implant in, and then they place a tooth on right away. The small issue is the success rate for that is not as much. So theoretically, from my understanding, is that an implant, you place an implant, you put the crown on, the success rate for that implant is about 96 to 98%. That's pretty good.
That is good.
I think that's really good. Okay. I've heard it said that if you have an implant, if you don't let the bone heal around right away, and then you put a tooth on, and now the person can kind of bite on that implant, the success rate for that bone to heal is about 80%. Okay, so when it's a front tooth, we try and make sure you're not touching it, you're biting on it. But again, any slight bit of contact with food, you're causing, we call micro movement. Okay, and so that doesn't allow for the bone to heal as quickly around the implant.
Okay. Well, thank you so much for breaking that all down. I actually learned a lot on that one. Thanks for joining us today here on YouTube for the Tooth Doctor, and don't forget to subscribe to the channel, like the video if you got some good information out of it, and we'll see you on the next one. Bye.